ENT or Otorhinolaryngology. This is a very important area because it's all to do with airway access and a common site of infections. Now you ought to get an anesthesiologist or anaesthetist to show you how to intubate an airway or at least place a laryngeal tube. You also have to learn how to put an otoscope, that's a device to look inside the ear and examine the eardrum. Now one thing to do with the airways, it's a very exciting area, ENT, and I think you may even enjoy going into it as a specialty. But you do need to know a lot of it just in your general in your practice as a doctor. One thing you do need to know is about bleeding noses. You need to know how to pack a nose. It's pretty important actually. This can range from a trickle to a major blow, hemorrhaging. So minor, that's usually the anterior aspect of the ear, or nose, to the posterior aspect. The swallowed blood is a gastric irritant that can be vomited. So you need to learn how to pack the nose with gauze, soaked in a vasoconstrictor, even a tampon, I said a tampon, or a nasal balloon. So maybe get the ENT guy in your clinic or hospital to show you how to do this. Very important to know how to pack a bleeding nose and to know what to do about it. Now pharyngitis is very common, sore throat, posterior pharynx, maybe difficult swallowing, usually a strep infection, but you've got to exclude an abscess. But look at the proviso here in bold type. Do not examine an airway in the presence of epiglottitis. Epiglottitis, do not examine an airway, as the airway may close down, you've got an immediate death. It's got to be done in the operating room where full airway access facilities are available, including anaesthetist. Epiglottitis, but most common variety pharyngitis can be dealt with, and you know how to deal with it. Now, common dental disorders. The thing about otorhinolaryngology or ENT, you need to know a little bit about common dental disorders because you'll be surprised how often you have to see them at night. Dentists tend to be a bit 9 to 5, so you'll be left with the problems at night. Now, you're also going to take great care with dental procedures where they'll be done in the presence of coagulation disorders, CVS problems, cancer, immunosuppression, neurological disorders, certain drug therapy, radiation therapy, because basically there couldn't be a lot of bleeding post-op after dental procedures, and also they can be prone to infection. Dental emergencies, yes there are some, and you'll have to deal with a broken or avulsed tooth. Patient get very distressed, very expensive teeth. You can put them back into the socket, the avulsed tooth, or keep a warm milk until it can professionally washed and extend to the dentist in the morning. Now dislocation of a jaw, it looks a bit dramatic. The patient comes in drooling, and people can be a bit confused. Is this rabies? Is it some sort of CNS disorder or drug reaction disorder? No, it's just a dislocated jaw at the TMJ joints, and you basically put both thumbs into the mouth like this. See your thumb along the jaw, onto the jaw, and push down and back. Actually just slips back in position. You can look pretty good putting it back in. Patients usually know, they've had it before, so you could say it's a dislocated jaw, mandible, and they'll shake their heads. Post-extraction pain, you can get severe pain after tooth extraction, so you may need to give antibiotics, painkillers. Toothache and infection, patient comes in the middle of the night, severe pain, coming into the clinic, emergency room, you've got to give some treatment before they see the dentist in the morning, so you've got to have a little bit of an idea of what you're doing. Now this is because the caries goes down from the enamel into the dentine, that's an E there. May need to pulpitis, that means the pulp around it. Pressure necrosis getting worse, or periapical abscess, they're getting very sick and they may need a drainage. Some common dental problems, let's go over these now. Caries, tooth abscess, acids, tender, painful teeth, warm, probing of the teeth, treatment removing the affected tooth structure or restoring it. That's really dental work, isn't it? Gingivitis, painful swollen gums. It's quite common actually, maybe just a dental hygiene problem. If it's quite advanced, then you may need to treat with antibiotics or drainage or any pus collection. Note, acute necrotizing, ulcerative gingivitis, painful bleeding, bad breath, needs gentle debridement, antibiotics. Periodontitis. That's seen with diabetes, leukemia, Downs, Crohn's disease. It's really where the patient is very prone to infection, very bad infection of periodontium, inflammation of periodontal ligament, and down into the bone. Worsening of gingivitis, and you can see of some patients who've got HIV, immunosuppressed abscess develops. Diagnose, exam, swelling, x-rays, dental cleaning, extends under the gum vigorous, hygiene program. May need drainage of a collection. Pulpitis, inflammation of dental pulp from untreated caries, trauma, diagnosis, exam, obvious. The external ear problems. You can have some inflammation or dermatitis around the ear canal, each skin change or discharge from the ear, swimmer's ear. You can have malignant external otitis. This is a pseudomonas osteomyelitis of the temporal bone. A bit unusual, but can be present. Severe pain, patient quite unwell, delirious. Other external air problems, obstructions from wax, got to wax out the foreign body, yes, children, insects, buzzing, noise, driving them crazy. Got to extract or remove the insect to get a very grateful patient. Use otoscopic examination. Perichondritis, inflammation of the perichondrium of the pinna, the cartilage can be pus there, needs to be drained. Now, hearing loss. If it's sudden, it can be pretty important actually. Develops a few that's a sudden deafness, means hearing loss developing within a few hours. It can affect 1 in 5,000 people. So you've got to really look at this and sort it out quickly, because it can range from the following things: inner ear disorders, acoustic neuroma. It's not that uncommon. The Schwann cell derived tumor of the 8th cranial nerve, vestibular division. Symptoms: unilateral hearing loss. Can be gradual but may be sudden. You need to work it out really well. Do an audiogram, MRI, because this is quite a serious condition and they may need brain surgery to remove it. Benign paroxysmal positional vertigo. It's another common one. We're moving from hearing loss to now benign paroxysmal positional vertigo, head spinning, common, quite disabling. Can be brief, under 60 seconds, and can be precipitated by certain head positions. They get nausea, nystagmus, clinical examination. Now, there is a procedure called Epley maneuver. You can look this up. Basically, moving the head in a certain position precipitates this positional vertigo. Treatment is drugs and surgery. Surgery rarely. Herpes zoster. This is something you'll hear about a lot. Genicular herpes, Ramsay-Hunt syndrome, viral urinitis, infection of the 8th cranial nerve, and genicular ganglion, facial nerve, herpes zoster virus, severe ear pain, vertigo, vesicles, the distribution, bowels, palsy, the sort of thing you see in exams. To steroids, acyclovir, rarely surgery. Meniere's disease. You've got to know about this, it's quite common. Meniere's disease, inner ear problem that causes vertigo, fluctuating centroneuronal hearing loss, and tinnitus. Quite disabling for the patient. There's no actual diagnostic test. Usually self-limiting. Vertigo and noise are treated with anticholinergics or benzodiazepines, diuretics. Low salt diet may decrease the frequency of the episode. Severe cases, you may need to do some surgical intervention, ablate the vestibular system with topical gentamicin or surgery. Purulent labyrinthitis. This is what killed Oscar Wilde. In other words, got a bad ear infection, went into the bone, went from the middle ear, causing osteomyelitis. So you got deafness, loss of vestibular function, needs antibiotics. Vestibular urinitis, a self-limit episode of vertigo from inflammation of vestibular division of the 8th cranial nerve. Some vestibular dysfunction may last. Treat with anticholinergics, antihistamines, Valium, and maybe a burst of steroids. Okay, second part is going to be on laryngeal disorders.